positions, and then primarily faculty, staff, librarians, and faculty. My name is Lisa Kroichensky. That's a mouthful. You can just call me Lou or Lisa. I will respond, and please just feel free to yell at me. But I am a nurse by training. I just finished my training heading into becoming a midwife. So I have a few years left of that, and I work with what's called the Better Evidence Program in Boston, which I'll describe in a little bit on bringing UpToDate to medical schools for this first year, which has been an incredible program to work with. My colleague Olivia here is also going to be helping me out with the training. I'll let her introduce herself when she speaks a little bit later on, but just wanted to get us started on this. So here's what we'll do today. And apologies, raise your hand if you do not have a laptop, tablet, or phone in front of you, because we will be logging on and using the tool. Just let me know and we can sign you into a computer too. But I will assume that everybody has access and we'll walk around and help out with this. So, who has used UpToDate before in any capacity? Raise your hand. Imagined, okay? So a lot of this will not be new to you, so we'll just run through some of the features, and if you think that you already know everything, we can just show you some of the new ones. But we'll talk a little bit about what UpToDate is. We'll introduce ourselves in the Better Evidence Program just to give you a little bit of context for why we're doing this. Olivia will talk specifically about a provider program, which is very different from what we're doing with medical schools here, and I'll just introduce the medical school side of things, and then we'll jump right in. We'll register for your account, and we'll talk about how to use UpToDate. And I want this to be interactive and playful, so please just interrupt me with any questions that you have, or if something doesn't make sense, want me to talk louder because I know I don't carry very well. I'll try harder on that. Okay, so for those of you who don't already know UpToDate, UpToDate is an incredibly powerful evidence-based tool that is authored by almost 7,000 doctors, physicians from around the world, whose job is to take on a section, their specialty area, and synthesize information from evidence-based practice and publications into effectively guidelines that are meant to be used in the point of care. We have currently, UpToDate's most recent numbers are that about 1.7 million providers are using UpToDate all over the world and across 190 countries, and we've had the privilege to play a role in bringing that to many countries, and Olivia will talk about that in a minute. And they use it to find their most pressing questions. So again, reiterating that this is, for medical students, I think it will be a very strong learning tool for the classroom setting, but also for clinical interactions in the moment. It's that fast and it's so powerful. Again, everyday clinicians read topics covering about 25 different specialties 1.5 million times, and that's every day. And the important thing that I want to emphasize here is that there's been over 200 research studies showing that hospitals and medical schools that frequently use UpToDate have better patient outcomes for their hospitals. Shorter lengths of stay, reduced infection rates, etc. Which is, for me, I think, probably the most powerful statistic for this. Excuse me. Here's just to show that there are 3 ways that you can access UpToDate. We'll talk about all of these today. On your computer or your laptop, on your tablet or on your iPhone, and some of those can be also offline versions, so you don't have to be connected to data, which is great. I know in many hospitals, especially in mine where I work at home, some of the hallways don't have it, sometimes it just cuts in and out, so it's best to have it on your phone offline. So that's very, very quick. We'll talk more about UpToDate, but I want to now give you a little bit more context of how we came to be here, and hopefully just be able to give you a better picture of why it's me standing here in front of you. So Ariadne Labs is a center for health systems innovation based in Boston. They're parented by 2 institutions, one of which I'm sure you will recognize the name. It's the Harvard School of Public Health. The second is the teaching hospital, the main teaching hospital at Harvard Medical School, the Brigham. We're founded by a man named Atul Gawande, who some of you interested in surgery or anesthesia might have heard about. But what this lab does is it created the surgical safety checklist and is now working on implementing them in hospitals across the world. We have a program called the Better Birth Program, which is aimed at childbirth health and outcomes in that realm. We work in serious illness, primary care. We're only 5 years old, which is relatively young, I think, for a center and nonprofit like this. But Better Evidence is a program grew from Harvard and has just joined us at Ariadne, which is how Olivia and I became involved. UpToDate, I think, doesn't need much more of an introduction than what I just gave you, but effectively this is just to show the partnership between the Meta Evidence Program and UpToDate, who is so generously donating many licenses free of cost. So we were able to bring, there's a justice issue here, which is that information is way too expensive and not accessible in parts of the world where it needs to be. And they're recognizing that and working towards reducing some of the barriers to be able to access it in some places. I'll turn it over here now to Olivia to talk more about our specific branch. So as I mentioned before, we have two, the provider track and then medical schools and institutions, which I'll talk about a little bit more.
So I will go through this fairly quickly, but Better Evidence started as a program only giving UpToDate subscriptions to individual providers. So their institution would not get it. These are providers who are directly working with patients who are out of their schooling completely, if not almost completely. And we have a rather large cohort of those donation recipients. Right now we've distributed over 20,000 of those across the world. You can tell we're very geographically spread. We have quite a few countries in Africa who are hitting quite a few, but actually our biggest right now are in Nepal and Pakistan. And those are signing up, completing an online application form, and then getting an individual subscriber to your account. Before we started doing larger institutional subscriptions and before we really started reaching out to medical students. So the idea was to meet clinicians really at their practice, and then eventually evolved into meeting students or meeting providers at a different stage of their medical education to really induce the habit and really introduce the tool earlier on so that they could carry into their practice and become a more evidence-based practice as opposed to just dropping it individually, although this recipient donation program is still going on and getting larger by the day. And one of the things we've learned from this is recipients are really satisfied with the tool. We have a 9.7 provider score, so the likelihood of recommending the donation program to a colleague out of 10. And this is actually higher than the domestic US net provider score, which we're very happy about. 98% of the people that we give it to use it at least once a week. And 96% say that providers who use UpToDate think that their clinical decisions are frequently or sometimes better than before they got the tool. There's also the potential to leverage this data and analytics to assess epidemiologic trends, to use it for public health. So this is number of confirmed Ebola cases in West Africa. And here in the gray line is when symptoms or related Ebola searches started coming in through UpToDate. I believe that was a full 90 days before the first confirmed case. So what could you do with that 90 days? What could you do with information about other epidemics before they start? How do you identify them? This is a huge opportunity here in our program to really use that data to its fullest extent. This is also a similar idea. The MERS searches in Saudi Arabia correlate significantly with reported cases. Not only correlate, but often precede cases. I will do a tiny pitch here. Because we are offering an institutional subscription, everyone at the school gets it, including associated hospitals. If you have providers or people in mind that you think individuals who won't have access through the institutional subscription, but you think want to or would be relevant or meet our eligibility criteria, you're more than welcome to direct them to our website. It's there.
It's very sensitive. So any provider who signs up by going to this website, and again, they exist outside of an institution like Makerere, somewhere rural, but they still have access, they're able to register for a 1-year free license, renewable annually. So it's up to them how quickly they finish the renewal application every year. It's relatively fast, I think 10 minutes. Indefinite access to UpToDate. So we've had, again, almost over 20,000 licenses donated this way.
I'll hand it back to you.
Sure. Thank you, Olivia. So the Better Evidence for Training program is what we're calling access through institutions. And I want to start here with a pilot study that we've just wrapped up at MUHAS in Tanzania and the University of Rwanda. we didn't know what it would look like to do this at a medical school level. So we just started with gathering some basic data. For example, for us, it was revolutionary in terms of how we would be able to bring UpToDate to medical schools, to realize that 97 and 92% of students actually own smart devices. They use them in their education every day. That's equivalent, if not more than US rates, in both Rwanda and Tanzania. So that's, for us, that was a measure of feasibility that we would be able to do this. What we noticed just sort of at a large scale is that in the very beginning, students were using mostly Wikipedia and Google to look up any disease that they came across or something that they were studying for. And by the end of 1 year, you can see this orange line, dramatic increase in using UpToDate. So they liked the tool. But for us, we needed to be able to see that in order to invest in going forward with this. This is just a basic graph. Like along this axis, you'll see topics read per month by students. That's our proxy measure for usability or usage, if you will, and just dates of the academic calendar. Huge usage while preparing for exams. Massive drop as they go to summer break. Good for them. They should take some time off. But then they go back into clinical practice. And here now you start to see it sustained, even as they graduate and go on. And the reference line here is one topic per day. So they're going on almost multiple times a day too. So we call this habituation over time and carries on past medical school, which I think is pretty powerful. So taking this data, we now have what we call a training program. This is a list of the first universities that we've partnered with. We're calling them our first cohort. Very glad to see University of Makerere on here. As somebody, I just joined this program quite recently, and I know we've been working very hard with Allison and Dr. Moses. Thank you so much for your help on this. The first time that I saw Allison take a picture that she was able to register was for me such a great moment. So thank you for working with us. And we'll be going to Embarara tomorrow to also have an institutional license with them. Our hope is that we'll be able to go to more institutions in Uganda next year, and maybe even some that train mid-level providers. So just very, very basics, and then we'll log on and register and go through the tool itself. As of last week, any student, any faculty member, any resident or clinician who has access to the University of Makerere, even some that might come here once a week or once a month from different institutions, can log on and register for their own accounts. The access is for 5 years with the option to renew, so it's every year it renews automatically. You can access it by computer, tablet, or phone, and we'll talk about some of those more specifically. The caveat here, and I want to stress this, is that every 90 days you have to log back in through Makerere in order for it to stay current. Otherwise, it will lock you out. So for those providers who aren't here so often, we have to reiterate to them that I would love for them to access an account here, but if they don't come back in 90 days, they might get locked out. Any questions before we start going into the immediate training component of this? Okay. So then I will ask you all kindly to please visit this website and hit the registration button. If you already have an account through some other way, then it will direct you to log in. If you're paying for that account, I would encourage you to try to register with a separate account to get the free license, but I will defer to you. And we'll walk around and help you, but effectively now it will just ask you to register, and you'll see University of Makerere in the top, which is such a source of pride, and then register, complete the form, and hit the registration button again. Feel free to raise your hand if you have any questions, or if it's not coming up for you or anything. Maybe 1 or 2 people are still working. So Olivia will go around and try to help you register, but just to not take up more of your time, if we could just go through some of the features together. I'll do it up here and you can follow along with me on yours, okay? So you're now logged in. You see up here my name. This is my account. It will save my preferences. Under here, it saves my search history. So the things that you most frequently search will be there. If you bookmark anything, and I'll show you how to do that, it will be here. Another really interesting thing is that if you enter and you see there are none right now, but sometimes there will be an orange dot. next to the search term, and that confirms that something new has been added, it's updated. So if it's a practice guideline, you can go there and see what that is. On this main front page, if you click on Contents, and then go to What's New, you can search for your specialty, for me, obstetrics and gynecology, and it comes up with all of the most recent updates to the practice that you can just read through. This is the most recent from July 2019, so maybe once a month, something new here for you to read about. Similarly, under Contents, practice changing updates. These are mostly related to guidelines. So again, it's not by topic area, it's just across the board. You can see every now and then if there's something new that's relevant to your practice here. Any questions about the updates or anything as I'm talking, just tell me to stop talking and we can talk through them. The next tab that you'll see here is calculators. And this one always blows my mind a little bit because look how many different kinds there are. Everything from APGAR scores to BMI calculators. I think for your students, over 200 different things that they can use in the moment of practice. I think this would be very, very helpful for them. Surgical risk assessment, etc. I think because, just for the sake of time, I won't go through so many of these, but you can look for yourself and just remember that it's up here under calculators. So again, I'm going back to the main page right now just by clicking on this UpToDate logo up here. And then I will show you one more thing, drug interactions. As a nurse, I thought this was so cool. So if everybody could click onto drug interactions. If you are in currently, and just follow along with me. Then scroll to the bottom and click continue. It's just an agreement for you to be able to access. It takes you to a place called Lexicomp Drug Interactions. I think this will be most relevant for the clinicians in the room, but librarians, please do tell your students about this if you're training them. Type in any 2 drug names. So I'll do anything you want. I've typed in rifampin and cefazolin. And then if you click Analyze, and you can do more than 2. You can do 5, 6, 7, or 8. It doesn't matter. It gives you the drug interactions. For me, the 2 drugs that I put in, it says Category D, Consider Drug Modification. So for students who are first starting to learn how to prescribe medications, to double check themselves, are these safe to give together? It's very important. You'll note up here that the categories, X, red, obviously that means avoid the combination altogether, and it goes all the way to no action needed. They're completely safe to give together. Here you can also put in dietary things. So if you have patients who drink a lot of green tea, for example, that interacts with a lot of things. You can put it in here to see if there's any increase in a drug's modality, mechanism, or decrease, or anything of that nature. So this is a very, very important tool. The one thing that I want to note is that it does not, down here, it does not address chemical compatibility. So if you have a student who's wanting to know, can I give to one patient in the same IV 2 different drugs, it does not assess whether those drugs would have a chemical interaction, but systemic only.
Excuse me.
Yeah.
Does it use the trade names or
If
the
you,
generic names?
I believe you can search by both.
Because I did cetamol and penicillin
And you didn't recognize it? Okay. So penicillin did not come up for you at all? For me, any of these you were searching for? It's
the items found was
oh, and you have to do them one at a time. Oh, sorry about that. Adding the drugs one at a time. Yes. Paracetamol, penicillin. What is that? So you add them one at a time. Let's see. I add green tea, and then you click Analyze.
The analyze button.
About drug interactions. I think it's one of the coolest things in the tool. It's cool, yeah. There's another one I think you'll really like then about drugs. So can we go, all of us, back to the main page? And into your search bar, type whatever you would like, anything you want to look up. I'm going to do cesarean section. You can follow along with me if you'd like.
That's one.
Cesarean section. But you can look up anything, it doesn't matter. You'll see across the top here, I've just highlighted them, 4 different categories. All puts everything together. If you click on adults, it filters only by content that's relevant to adult patients. For pediatric, relevant to pediatric patients. Patient is a little interesting. It's patient-facing information. So again, for students, if they're just learning how to tell patients information, relay complex clinical diagnoses, they can go here and find language that is relevant for lower reading levels, etc., and more common language around that. And then graphics, I will actually show you. Again, I think this is very, very amazing. You now have access to 30,000 and more different graphics. I searched C-section, it's not a very good graphic. I'm sure if I were to go down, you can see some graphics, for example. I don't even know what that is, but I think that's fascinating. So students, if they're using, must be some sort of, it's lesions. Uterine fundus, part of the body, are completely seated with multitude cyst-like structures. Exactly. Our resident OB-GYN. Here the important thing is you can export directly to a PowerPoint. So you can get, I like that reaction, I like that. So if you or a student has to give a presentation, hit that button, it goes directly into PowerPoint for you. Remember earlier I mentioned bookmarks? You can do bookmarks for both graphics and for pages just by clicking here. And then when you log in on your front page, it will be under bookmarks. You can just easily access it so you don't have to find it again. Okay.
How did you get to graphics?
So I searched cesarean section. Here you can do all, and then it comes up with just the pages of information. Adult contents, pediatric. For cesarean, it won't be so important. Maybe for the neonates, there'll be some content. Patient is patient-facing information that your students or you can use. I have to be honest, I don't know how relevant it is globally. I would love to hear feedback from you if you think it's relevant for your patients, for example. I find it's relevant for my patients in low-income communities in Philadelphia, but I'll be interested to hear from you. And then graphics, here it is for you.
The graphics is not showing.
It's just share. You can't export.
You can.
The share the same as exposure.
What I'm noticing that there are some technicalities we'll have to figure out between certain phones and yes, exactly. So I will look into that because some people's phones are working just fine and others are not, but computers are working great. So we have some troubleshooting to do, but you will definitely be able to export to PowerPoint. Yeah. Any questions about the filters for searching? I should also note that you can.
What's wrong with
I don't know. I'll have to sit down with her and see maybe you just didn't want to.
You need to accept something.
Can you try cesarean just because we're working on that? Yeah. There we go. You found one thing that didn't happen. I'm so sorry. I think I'm sorry to rush. We only have 8 minutes left, and then I don't want to take up too much of your time, and I know that there's a lot to go through. But let us now go into all and just go into a page to look at some content. So I will just look at, I don't know, we can just go to surgical technique, this first one, for me. You'll note up here, Up here, you'll notice that there are authors. So remember I was telling you that the people who are editing it and who are writing the content, you can now look and see who they are professionally too, where they practice, just by clicking on their name. Here on the left, you'll have a toolbar. This is a table of contents. There's a lot of information in all of these pages, so I think it helps to just go through and find the thing that's most specific to you. Here, you will notice that there's a link to this number. And it doesn't send you directly to the article, but it sends you to an abstract. And then this one doesn't have much information, but we were clicking earlier, you can go to PubMed, and for most of the journals that you have access to, you can access it directly that way. So if either you or your students and residents want to read the original research that has gone into this, you can access it that way. Excuse me, I'm running out of breath. Here you will also see a lot of different pages that are relevant enough. So content, if you're maybe not finding exactly what you want, you can search through a little bit more. I want to find for you a drug name. So I'm going to search for cesarean. I've just gone to a different page. You don't have to follow along exactly. But what I want to find is the name of a drug listed within here. So here we go. You'll see again, it's green, it's underlined, so it's a link. This takes you to the second very cool medication-related page that you can access. It's called Lexicomp. So everybody that now has an UpToDate account also has access through UpToDate to Lexicomp. And here you'll notice this is amoxicillin. You have dosing for pediatrics, dosing for renal impairment. Again, I think for patients, or for students, it's amazingly important to have this. Everything to adverse reactions and contraindications for every drug that you could possibly want to search for. So earlier I showed you how to search drug interactions for what you've already prescribed or are thinking about prescribing. This is for every drug that you're thinking about, more specific information for them. Pregnancy risk factors and implications, etc. And you can access that just by searching for a drug name. It comes up, click on it, and it'll take you to this other website that comes from UpToDate. Okay, so, excuse me. So let's say that we're still within cesarean section surgical technique. I'm just flipping through and I go to the bottom. And here is the complete table of contents, the complete table of references that was used to write this article. I think, again, for students, it's important to see where the data comes from and to understand that this is from creditable resources like ACOG, etc. So you can see it like that. Up here, if you prefer, there's some basic things that you can do, such as making your text bigger or smaller. Here I've hit bookmark because I use cesarean section all the time. So it's the first thing to come up when I'm on my page. And I can print it. It goes directly into a PDF if you'd like to print it. Or you can share it. And if you click on share, you send in an email address and it sends this page with access to whoever you'd like to share it with, a colleague, another student, a resident, etc. If you found something interesting or relevant to a specific case. So, just for the sake of time, I know I kept you here for the full hour, and I wanted to do it more quickly. But we've just gone through the very basic features of UpToDate, how to do drug interactions, Lexicomp, and how to search. Every one of you has a sheet here that I gave you that has the complete features on it. They're at the front. If you don't have one, we can give you one on the way out. But in the last 2 or 3 minutes, are there any questions other than it seems like we have some technical difficulties to work out with some phones that I will work on it and communicate with Allison when they're fixed? Any questions related to the tool that I can answer for you now? No? This is
Any dangers of the tool?
I'm sorry?
Any danger?
Any dangers?
Dangers, like what?
Context.
It's,
I didn't mean to ask that, but when you look at, when you search for literature and evidence, we're being used to systematic reviews, clinical trials.
Yes, I understand your question.
all studies. Where does UpToDate come in?
so UpToDate is expert opinion. It was written through a process like a systematic review because it's pulled together all this recent data, but it's not, if you were to, I would not encourage my students to cite it as primary research. I would encourage them to go to the journal article that was drawn from for UpToDate. The reason that UpToDate is so powerful because it's effectively somebody constantly doing a literature review for you and also searching the most recent guidelines from the WHO and globally. So it's expert opinion in that sense, and it's meant to be used as a guide, not final. Does that answer your question?
I think really, if you want to, instead of reading the text,
That is it.
there are review articles, but you find, such a review was done like a few days ago. So instead of like searching for, you read a textbook of 4 years ago and then try to read what is there around this topic.
Exactly.
You
Yeah.
find that the article in UpToDate was reviewed just yesterday.
Exactly. Even my closest friend is in medical school and in Rhode Island, and he's using a textbook that's 10 years outdated. When he's in the hospital, he's only using UpToDate. Yeah, I did the same when I was in school too. And you don't have to carry it, which I think is good too. It's always there with you in your pocket if you need it.
For the Makerere opportunity, must you have a Makerere email to
No,
register?
no. You just have to be on campus.
Oh.
So it's an institutional license. There, it's unlimited. So even if you have visitors who are only going to be here for 3 months, rotating to this hospital from a hospital that doesn't have access, they can register and use it while they're here.
So how far must you go for it not to be useful? Like 200 kilometers, 20 or 500?
Oh, I see your question. I don't know that specifically. That's a question for Bob John. Exactly.
Outside.
Yeah, I don't know how far.
It's an IT issue. Like our Makerere address.
Whatever is Makerere is bandwidth.
So
But we're-
Makerere Medical School moves to the main campus, so will that work there?
Yes, because the
It's the
IPs
same
that we gave them are
IP.
cross-country, they are the institutional, not just for the College of Research.
And once Bulago has moved over, they will also have a new IP address, and we'll add that as well.
Okay,
Yes.
yes.
No, please, ask your question.
Can we access this on the phone? Can we access it outside the local area network?
So, two answers.
Yes.
The first is yes. It's as soon as you've created a login, you can do it on your data through the website, or when you're on Wi-Fi, I would recommend going to the Apple App Store and downloading for free the UpToDate app. And then you can just log in through that. It keeps you logged in so you don't have to remember your password. If you have a very good Wi-Fi connection, you can download that entire app and use it offline. So you can use it through your app, which is data, or connected to Wi-Fi if you're here, or you can have a good Wi-Fi source once and download the whole thing. It took me 5 minutes, and then you can use it completely offline. Yeah. The second part of that question is that I understand some of you are still having a hard time registering from your phones. I think if you register on a computer and then use it through the app, you should not have problems, but I will check in to see if that remains a problem, and we'll do our best to fix it. Yeah, thank you so much for coming here and listening to me talk for an hour. I appreciate it.